This one could be a huge story in the days to come. A huge whistleblower lawsuit has been filed against the drugstore chain CVS Caremark, alleging it overbilled the government by hundreds of millions of dollars in an elaborate pricing scheme. That money that was lost impacted millions of Ohioans on Medicare. But as consumer investigator Danielle Serino reports tonight, if the allegations are true, the fraud could impact many more.
The case centers around accusations from a specialist in drug costs who worked at Aetna, which happens to be one of the largest Medicare drug clients of CVS Caremark. She claims Caremark did a great job of negotiating prices with manufacturers to provide the drugs, but did not pass those savings on to insurers like Aetna that contract with the state.
There is a tremendous amount of fraud going on here because there's no transparency.
Antonio Chacha from the Ohio Pharmacists Association says the lawsuit filed by a former Aetna employee is a bombshell, blowing open what he calls a shell game by companies like CVS Caremark, which are hired to help keep costs down.
CVS Caremark is essentially being trusted to pay for your prescription drugs through the Medicare program. And the allegation from the Aetna whistleblower is they're billing a much higher amount than what they're actually paying.
In the lawsuit, which both Aetna and CVS fought to keep private, but we were able to obtain, CVS is accused of submitting false Medicare Part D drug costs for at least the past 10 years. That those false drug costs caused Aetna, which is one of CVS's biggest Medicare drug clients, to pay as much as 25 to 40% more than its competitors. And as a result, federal and state health insurance programs that contracted with them also had to pay more.
If you're a patient, this could impact the amount that you're paying at the pharmacy counter. It could overinflate your copay. But as a taxpayer, this ends up impacting everybody because the cost of prescription drugs is going up, and thus the bill to the federal government is going up.
CVS issued a statement which says, in part, this complaint is without merit, and we will vigorously defend ourselves. We comply with all laws and regulations related to the Medicare Part D program, adding the government declined to intervene in the case. But here's where this really hits home. While this suit involves Medicare patients, the Ohio House is now looking to see if this is also going on in the state's $3 billion Medicaid program. It recently introduced 2 bills looking into prescription drug pricing, as CVS also oversees the pharmacy benefits for 4 of the state's 5 Medicaid managed care plans.
This is really just the tip of the iceberg.
What's interesting, especially considering Aetna didn't want the details of the lawsuit released and they were ostensibly harmed by this, is that Aetna and CVS are trying to get approval for a merger. I'm Danielle Serino, Channel 3 News.